Why was Ike once dismissed as a mere bladder nuisance? Imagine experiencing frequent urges to urinate, pain, and discomfort, but doctors tell you it's just in your head or a minor irritation. That's how interstitial cystitis was often viewed in the past. Interstitial cystitis, now called interstitial cystitis or bladder pain syndrome, was once dismissed as a minor bladder nuisance because its symptoms are so similar to common urinary tract infections and other bladder issues. The problem was, unlike infections, tests like urine cultures usually show no bacteria or infection. Without clear lab results, doctors found it hard to recognize it as a real, serious condition. Another reason it was overlooked is that the symptoms can be very subjective and fluctuate over time. Some days, patients feel worse, and other days, they feel better, which made it seem like a minor problem or psychological. Many patients went years seeing different doctors, trying to get a proper diagnosis, but because the symptoms mimic other conditions like overactive bladder or pelvic pain syndromes, it was often misdiagnosed. Early on, the medical community didn't fully understand what caused these symptoms. Without evidence of infection or cancer, many thought it was just minor irritation or even psychological. The term used to describe it was often painful bladder or urgency frequency syndrome, which didn't sound serious enough to warrant attention. It was only later that research suggested possible causes like defects in the bladder lining, nerve issues, autoimmune responses, or pelvic floor dysfunction. Because of these diagnostic challenges and limited understanding, many considered it a nuisance rather than a real disease. It was only with advances in research and better diagnostic tools, like cystoscopy and biopsy, that doctors began to see it as a distinct, chronic bladder condition. Unlike bladder cancer, interstitial cystitis does not involve malignant changes, but it can severely impact quality of life. Understanding this history helps us see why interstitial cystitis was once dismissed. It's important to recognize that symptoms overlap with other issues, but proper testing and awareness have helped establish it as a serious condition. If you think you might have bladder pain or urgency, always consult a healthcare professional for an accurate diagnosis. Remember, each person's experience is unique, and proper medical guidance is key to managing bladder health effectively.